I decided I wanted to be a physician when I was really young. I always assumed that being a doctor was associated with helping people and relieving suffering, and I think that was my motivation. I went to college and medical school during the height of the affirmative action era. I think that anyone who thinks that I got a free pass to get into Wellesley and Harvard doesn't understand what affirmative action is. The assumption that somehow black and other students of color were not qualified was absolutely wrong. And I still think that there are challenges that African American women face in this field, even though for a couple of decades now, medical student bodies have been more than 50% women. If you look at leadership in medicine, men are still leading, and it's very rare to see a person of color. People see a black woman and say, oh, not a doctor, something else, and they go down the line until they've exhausted just about everything, and then, yeah, you're a doctor. So I think that is less and less true, but it certainly was a challenge as I started out in this field. The NAACP has also been this kind of shining light of understanding what it takes to chip away at the inequities and the incredible barriers that people of color have experienced in our society. And so it's always represented to me the type of organization to look up to thank, to be grateful for, to say, you know, the history of the organization represents such a huge part of how we got to where we are today. When we arrived, the healthcare bill was brand new, and it was our responsibility to implement a lot of the aspects of the healthcare reform bill in Massachusetts. And one of the things that I did was to make sure that we didn't do things that would make low-income people more vulnerable, and to make sure that they saw the fruits of this law. We have decreased the uninsurance rate among Black and Latino people in Massachusetts by more than half. That is a huge impact. With the implementation of the universal health law, we have not seen the number of people who are uninsured skyrocket like other states did during the recession. This is a good sign that this plan works and has multiple prongs to make sure that people have access to health care. I think we're doing better than most in this economic downturn. One of the things that we're trying to do is a really integrated approach or strategy to eliminating disparities. We need to comprehensively look at our approach to both policy, delivering services, and again, fostering this intersection between healthcare access and addressing social circumstances. Leaders really need to be responsible for thinking about what is it we're trying to solve, what are the old ways that are not working, how do we introduce new ideas. But one of the things that I try to instill in everything that I do is the principle that we're here to serve people, and we have to do the best that we can to provide the best that we can.